I'm Dr. Federo, a board-certified plastic surgeon, and I'd like to take you through an actual rhinoplasty consultation. At the time of consultation, I ask all my patients one basic question. What don't you like about your nose, and what would you change if you could change it? I will sit down with them and actually draw the changes that I would make to make their nose the desired nose. This young lady, a 23-year-old, came to see me complaining about her nose. She didn't like the bump on her nose, which you can see from her before picture, and she didn't like how round and big her tip was when you looked at her from the front. So at this point in the consultation, the patient has told me what she wants her nose to look like. We've had an opportunity to examine her. We've taken pictures, we've morphed those images, and we have a good sense of what we want to achieve. So at this point, I like to draw exactly what I would do to her nose to make it look the way she wants. And I find this is very powerful for the patients, and it also helps me work through the surgery, the upcoming surgery. So for her, I'm going to make a small incision between her nostrils, an open rhinoplasty, and I'm going to expose the tip and the bridge of the nose. And then I'm going to approach the septum from the top. So the first thing I'm going to do for her is I'm going to trim a little bit of the septal cartilage. This is cartilage and this is bone, and we're just going to remove a little bit of this cartilage. And what that's going to do is it's going to start to straighten the nose, which is a little deviated, and it's going to bring her tip up ever so gently because she needs a little bit of rotation there. The next thing I'm going to do is remove some of this cartilage, and I'm removing it to straighten it, but also to obtain some tissue to make the nose prettier. So we're going to take this cartilage, this piece of cartilage, and we're just going to put it in a little bit of saline in the back. And then I typically will remove a little bit of this bone, which will get removed. And so now what we've done is we've rotated her tip up, we've straightened the inside of her nose so her breathing will be better, and we've gotten some material to make her nose prettier. That would be the first part. It's very important that in a good rhinoplasty, the bridge of the nose and the tip of the nose are balanced. So whatever we do here, we want to make sure that we do something similar that will blend these two together. So for this young lady, she had a bump in her nose, and that bump is made up of bone up here and cartilage. And the first thing we're going to do is we're going to take a rasp and file down the bone until it's nice and straight, and then we're going to take a knife or scissors and gently remove a little bit of cartilage until this is the way we want it to be. Now, she has a very boxy tip, and so the first thing we're going to do is remove a little bit of this tissue. This is called the cephalic scroll, and we're going to take this scroll away, and that's going to rotate the tip up and make the tip more refined. I typically will put a few sutures in here to refine the tip even more, and so between this maneuver and this, we've now recreated a better proportion between the bridge and the tip. Now, that cartilage that we removed before, we're going to take a little strut like this, and we're going to take that cartilage and put it in here. It's called a columellar strut, and that's going to keep her tip out in a proper position and help rotate the tip as well and stabilize all this good work that we've done. So at this point, from the side, she'll have a nice profile with a refined tip, but now we'll have what's called an open roof. When you take down the central portion of the bone, you're going to end up with bone, flat space, bone. And so now we need to close that. So with a little punch, we're going to make little cuts in the bone here and here using a little osteotome and these little tiny cuts. And once there are little cuts in the bone will gently move in. So the bones were here and they're going to move in and like this. And what that will do is that will narrow the nasal bones, which will be desirable in her case, and will also get rid of that open roof. So once this is done, I call this is kind of when the magic happens, because the bones move and then the cartilage that's below is connected to the bones, so the whole sidewall will move in. So it's a combination of straightening the inside of the nose, reducing the bump, modifying the tip, and then bringing everything together at the end, and then we close.